Welcome to the Doctor Janine Show. I'm Doctor Janine Bowring, naturopathic doctor, and today we're talking about IBD, so inflammatory bowel diseases. I'll be talking about the causes, the symptoms, and some natural solutions for IBD. I'll be talking about IBS, so IBS-C, which is constipation, IBS-D as well, a little bit about SIBO, because I've had a ton of questions about this, also leaky gut syndrome. So make sure you're staying tuned for the entire show. I'm going to give you my 9 top tips about how to deal with these inflammatory bowel conditions, and some things probably that you've not heard about these things before, things that you can't just sort of Google and search. So it's going to be a great show. Make sure you're staying tuned. We do have our quiz section, so that's always fun, and we, from our sponsors at Petite, will be sending our lucky winner our vegan protein powder. So this is really fantastic, so make sure you're staying tuned. I know a lot of you love that quiz section. And it doesn't matter if you're, answering the right answer or not. We take all of your answers, good, bad, and the ugly, into consideration, and you have the ability to win. So that's going to be really fun. If you're new to my channel, welcome in. I hope that you're subscribed. If you are watching on YouTube, also hello on Facebook, on Instagram Live as well, and of course on TikTok. Now stay tuned after the show. I will stay on with my TikTok and Instagram viewers to answer your questions. So, and make sure that you're asking your questions as the show goes on, even just a shout out to say hello to me. I would love to see you. Also give me a big thumbs up, and whatever gifts and things you want to send me on TikTok and the other platforms throughout the show, I truly appreciate it. Okay, so first let's talk about some of the main causes of inflammatory bowel diseases. And I will be focusing in this show a little bit on the causes because I think it's often overlooked, whether it's the person who is actually suffering with the condition, with the inflammation and some of the symptoms, which I'll talk about as well. And also I think a lot of times by the practitioners, this can really be missed in terms of, what the actual causative factors are, and some of these things you may not have even heard about, but based on my own research in really looking at the root causes of the inflammation in the gut and the leaky gut syndrome, it's something that we definitely want to focus on and removing that cause. So a great analogy, you're in that boat in the middle of the lake and it's leaking, and you're bailing the water, you're bailing the water, you're bailing the water. And this is often the case for people who are suffering with inflammatory bowel diseases, is that maybe you're taking the medication, maybe you're, doing different things from the perspective of taking antibiotics, and you're sort of bailing the water, but you never really fixed the hole. So the same in the boat, if you don't plug that hole, and we know the definition of insanity is doing the same thing over and over again and not getting a different result. So, and the same thing can happen with your health. So this is why I'm really going to focus on some of the causes today so that you can get to the root cause of what is ailing you for your digestive complaints and that overall inflammation in the body. So let's start to talk a little bit about the diet. And I know this is where people don't like to make changes in terms of what's going on with what they're eating. It's very difficult to make dietary changes. But if you're in that, acute phase of inflammation, for anybody who is suffering with IBD disorders, that it can be super painful. And, often you don't have a choice but to change your diet. So one of the things to look for is the polyunsaturated fatty acids. So these are your omega-6 fats. They are very inflammatory to the gut. So whether it's the soy oil, the safflower oil, the canola oil, which again is something that people just don't have the right information. This is not something that you want to be ingesting. You want to do whatever you can to limit or completely cut out the use of canola oil, and margarine as well, because margarine has the inflammatory trans fats, and this is something that definitely getting these things out of your diet. And I really want you to watch if you're eating out, if you are eating anything that comes from a package. You wouldn't necessarily think that it's in there, but it's in so many different packaged foods that it's really difficult not to eat it, so you really have to clean up the diet. and watch those inflammatory fats. Another one is artificial sweeteners. So, I want you to check out my entire show, The Bitter Truth of Sugar Addiction. And this is really important that you are, and whether it's chewing gum, it could be something that you're adding to your coffee, it could be hidden in other, sugar-free foods. You really have to look for those artificial sweeteners because they destroy the microbiome. We're going to be talking about the gut and the microbiome as well. So that's something that you really have to watch for. Another cause can be dairy products. So there's something called A1 casein, which is in North American dairy products. So depending on where you're watching from in the world, New Zealand has much better dairy than what we do here in North America, but that A1 casein is very inflammatory to the gut as well. Another food group that is a problem is definitely wheat. So wheat, and we know the gluten. Most of the conventional wheat in the market today, especially in North America, the farmers have changed the grain and things have been modified, and this is very inflammatory to the gut as well. And it does contain lectins. So lectins are also found in some of the legumes, especially if they're not cooked, but also in tomato skins. So in terms of beans and things, make sure that they are very well cooked, and some people just simply can't tolerate these when your gut is in that super inflammatory condition, as well as caffeine. So caffeine is, you know that I love my coffee, but you can't overdo it because especially if you have an IBD condition, as well as alcohol can be, again, too much alcohol would be a problem. And if you are also not getting enough fiber in your diet, so this would be another causative, and people overlook the fact that fiber is super important for our overall gut health. And what happens, unfortunately, when we're not getting enough fiber is that we have a simplified flora in our gut. So I'm going to show you this really quickly. Let me just pull up my demonstration. So this is something that when we are talking about the diversity of our gut bugs, this is something that we want. We want to have a mixture and a good diversity of those positive organisms in the gut, and this would be healthier digestion. This would be, not inflammation. We've got those probiotics, which are good guys. Typically, I talk about Acidophilus and Bifidus as being some of the best strains of probiotics that are really helpful at maintaining enough of those good guys to have that healthy gut flora. Now, what happens when our diversity is not great is that we can run into a situation where some of those bad guys will start to become infested in our gut flora. So this is represented here by whether it's a parasite, some of those less favorable bacteria, and candida as well would be one of these things. So this is something when we talk about SIBO, the small intestinal bacterial overgrowth, we've got too many of these bad bacteria and they start to overpopulate the gut, and that's why we don't have that healthy diversity anymore. So this is why it's so important that we maintain that healthy diversity. So different, when we get to the tips, I'll talk about different ways to do that to make sure that we have enough of that good diversity, and fiber is one of those things. When we eat a fast, digesting, standard American diet, that's why it is called the SAD diet, this goes through our digestive tract much too quickly and translates into not having that good diversity, and this is a big problem. So for those of you on TikTok who have seen, and I'm sure on other platforms you've seen my demonstration, of course, about transit time. So how long it should take for our poop. So this is the famous poo-poo platter that I've talked about on TikTok. For that famous, the S-shaped poop to come out in terms of the time eating something that we can measure and seeing it come out of the other end. So this is called the transit time, and ideally the transit time is about 24 hours for adults. Now, having that gold standard S-shaped poop is what we're looking for, but the way you can measure your transit time is that you eat something that will be, demonstrable in your poop. So yeah, I do talk about poop. For those of you that are just tuning in, it's Dr. Janine, and I'm known for talking about poop. But we have something we have to talk about in terms of our overall health, especially if you have an inflammatory bowel condition. So what you do is you eat something like corn or beets, something that you're going to be able to see quite readily in your stool. And it's the time between actually ingesting it and seeing it come out the other end. So that should be about 24 hours. So let's say, tonight at 6 p.m., if you were to eat some beets, quite likely that is going to go through your digestive tract. And if it's too fast or too slow, then it could indicate a problem in terms of what's going on with your digestive tract. So that is, the best thing to do then is to get it around that 24-hour mark. So if I were to do it myself tonight, 6 p.m., I eat my beets. By 6 p.m. tomorrow night, that's when I should actually see that stool coming out. Now, if I tend to have, because I had a lot of questions on this, sorry to be graphic, but if I did this at 6 p.m., but my bowel movement is normally the next morning, is that, a good indication that would still be fine. It would still be, in terms of your own circadian rhythm. So there is a little bit of leeway on that 24-hour period, but just, something to think about and something definitely to check. So an ideal way to actually do this, which I've shared with my patients before, is to have that marker food. So whether it is the corn or, the beets, have it at the time when you normally would have a bowel movement. So it could be maybe not so palatable to have beets or corn if you have a morning bowel movement, but do that the day before. Then hopefully by the next bowel movement, you see that coming out in the morning. So, yeah. There you go. So I want everybody to try their poop transit time and definitely let me know how it's going in the comments, because I had a ton of questions. Okay, what if it's too fast? Well, that would be IBS-D, which we're talking about today, or if it's much too slow. So some people were, a lot of people were reporting back to me that they only go twice a month or maybe 2 or 3 times a week. I mean, that is super slow, and their doctor said that that was okay. Well, I have to wholeheartedly disagree with that's okay, because it's not okay, and that means that, there's definitely something that is not working appropriately in the digestive tract, and something definitely that you can do about it, and that's why we're talking about today's topic. So some of the other causes of IBD include drugs. So some antibiotics can cause, problems with the digestive tract and the inflammation in the gut, as well as aspirin and ibuprofen. So the non-steroidal anti-inflammatories are definitely related to small gut bleeding and bleeding in the stomach. So you have to really be careful of those, especially if you're on them chronically. And also proton pump inhibitors. So here's, a huge paradox that people have a lot of acid reflux and, they have GERD, and so they take a PPI, but it actually causes more inflammation in the gut. So again, this is why I talk about things and empowering over your own health and doing things naturally whenever you can. Also, heavy metal toxicity, so things like mercury, aluminum can also be another cause of IBD, as well as stress. So we always know that stress is a huge component, and all of my patients that I've ever tested for and treated for inflammatory bowel conditions have always had a component of stress. And it's not so much that you have the stress, because everybody has stress, but how you manage your stress in your body is definitely a factor. So if that's, not at a healthy spot for you, that's something definitely to work on. Also, brain injuries. So I have a whole show on this, so you can reference this. It's called Depression. You're not depressed, it's in your gut. So it's all about that mind-gut connection. And, I've had a lot of questions about, what happens if you've had head trauma and that has now affected your digestive tract and what's happening with your gut, then absolutely there is that connection. So please do check out that show. Also, strenuous exercise. So if you overdo it in terms of exercise, this can actually have a negative impact on that gut and that inflammatory response in your body as well. Now, there's some other causes of IBD include infections. So that is whether it's candida, which is that fungal overgrowth of, that normal organism that we usually do have in our gut, but that would be one cause of inflammation in the gut, as well as SIBO, which is the bacterial overgrowth in the small intestine. And one of the ways that this is actually diagnosed, but it's not the best test, it's not always totally conclusive, is a hydrogen breath test. So that's something definitely that your doctor may investigate. And, one of the treatments for SIBO, which is a little bit controversial, it doesn't work for everyone, is the low FODMAP diet. So I plan on having future shows on this. And what it essentially it does is it limits the oligosaccharides. I'll talk about it a little bit in the tips. And the other, sugars that can actually feed off some of these small bacteria, but as when you're limiting those and starving those bad bacteria from those sugars, then it can have a beneficial effect on the inflammation in the gut. And there's also something called the GAPS diet, which is the gut and psychology syndrome diet. So this is something else that can be very, helpful, because we know that the relationship between what's going on mentally. So don't forget, when I get to my tips, usually my 9th tip is always about what we do with the mind-body connection, and you might be surprised as to what I'll say in terms of inflammatory bowel diseases, so make sure you're staying tuned. Also, dysbiosis can be another cause of IBD, so that was that whole thing about, that improper diversity in your gut bugs and not having enough of the good guys or your probiotics. Also, H. pylori is another type of infection that can be related to the inflammation as well, and parasites, which is something that is so common. And for those of you who have seen my posts on parasites, it is not well diagnosed. So a lot of you have reached out to me and have said, yeah, my doctor tested me for that and they never found anything. Well, it doesn't mean that you don't have parasites just because it wasn't found on one test. They're very actually difficult to diagnose, so that's something that you definitely want to investigate further in terms of your own health and really advocate for your own body and do things naturally. And that's what I'm all about, doing things naturally so that you feel better. Other causes of IBD are nutrient deficiencies are very common. Also, children that have not been breastfed, that can sometimes set them up right from the beginning to have inflammation in the gut. Your marriage can also cause IBD, or who you live with, because you actually share microflora with the people that you are the closest to. So believe it or not, yeah, some researchers looked at the effects of marriage and living with someone and what happened. And I would have to say there's got to be some psycho-spiritual emotional things going on there as well, but sharing that same gut flora was definitely a factor in developing or being, free of inflammation in the gut. So really interesting information, as well as circadian rhythm disturbances. So this is something that we'll get to in the tips. So when you're out of sync with nature, then this can be a causative factor, and it's a huge causative factor for IBD. And of course, EMF exposure. So this has actually been studied, and I have a couple of studies that I want to show you and share with you. So in this study, we can see that the evaluation was made for the effect of radio frequency radiation emitted from Wi-Fi routers and a mobile phone simulator, and definitely it had an effect on the pathogenic bacteria, Listeria, and E. coli. So altogether, the findings in that study showed that exposure and that effect of the Wi-Fi and the cell phone signal on our gut flora definitely had a negative impact in terms of inflammation. Now, you may not have heard this before, and that's why it's so important to really pay attention to your environment and your EMF exposure. So whether it's your cell phone, whether it's your iPad, whether it's anything that's plugged in around you. I have an entire show all about EMF exposure, so I definitely want you to check that out. I'm going to be doing more because so many, I still get the question on social media, what's EMFs? People really don't know, and it really does have a negative impact on your health. Now, in another study that was done on EMFs, in this one, that the glucose and the growth of E. coli under an electromagnetic field after just 8 hours showed a spike. So increase in glucose. So here's the thing, if you have constant exposure to EMFs in your environment and blue light toxicity, this is really increasing your blood sugar levels, your blood glucose. So I get the question all the time, I'm trying to lose weight, I'm trying to get healthier, my blood sugar, I can feel that it's still not, and if I go back on eating carbohydrates, so you just really have this really fine line in terms of being able to get away with eating carbohydrates, that, yeah, it has a lot to do with your environment and not so much even the sugar anymore that you're eating. That's going to definitely exacerbate the problem, but it has to do with your environment. So decreasing that exposure getting outside. I don't want to give away all my tips now, but this is something that is coming up in my tips. So if you're just tuning in, welcome. It's nice to see everyone. I'm so glad that you're here and you're watching. So we are live streaming on YouTube, we're on Facebook, on Instagram, and of course on TikTok as well. So stay tuned on Instagram and TikTok. After the show, I will be answering your questions. It's so great to have you all here. So shout outs. I want to say hello to a few people really quickly. Kimberly and Raymundo on Facebook. Nice to see you. Thank you for tuning in. Also on YouTube, we have Veronica, Marie, and Desiree. Nice to see you. Thank you so much. It's so great to see you all. So we're going to next be talking, I believe, about the symptoms. Yes, we're going to be talking about the symptoms really quickly, and I know I'm super behind on my stream here. Your local Muslim is here. Thank you for tuning in. Nice to see you. And Alexandra is on TikTok, and Sarah, nice to see you. Hello, Alejandro from the Netherlands. Nice to see you. So this is so fantastic. Anne is from Calgary. So, and someone's here from Philippines as well. Sonia, you're here from Texas. And Mama Thea, good morning. Nice to see you. So great. Thank you everybody who has tuned in. Make sure you stay on after, because remember, and don't go anywhere because the quiz is coming up in a few moments. I know I'm talking, I have so much information. I have to get it all out before we get to the quiz. Okay, let's talk about the symptoms of IBD. So anybody, I mean, it's not a surprise to anybody who has inflammation in the gut or SIBO or candida issues, that on the mental sphere, and this is where I'm going to start, because people don't always realize how much it can really affect what's going on for you mentally and how you're feeling about yourself and about your environment around you. So whether it's memory changes and poor memory, you could be very moody and have a lot of mood swings and be very irritable at times, but then you can also go into, deep depressions and low mood. Also difficulty with focus, so brain fog and ADD, even ADHD can be related to what's going on in the gut. So this is something to really pay attention to the children as well, because maybe they've got some inflammation going on. They get the tummy aches here and there, but it could be, and the good news is that, these are things that when we get to the tips, things that you can do for the children as well to really help them to decrease that overall inflammation in the gut. Also in the skin, so there could be skin reactions and rashes. So this could be acne, it could be psoriasis, it could be rosacea. So rosacea is very much in sync with what's going on in the gut, and eczema as well. So any kind of, chronic skin rash that keeps coming back no matter where it is on the body can definitely be related to the IBD. Also, allergic reactions, so whether it's asthma can be related to this as well, and a lot of autoimmune disorders. So this is where we talk about leaky gut syndrome, which I'll get to in just a second, and why it's so important that we are actually repairing the leaky gut. In terms of the gut symptoms, certainly gas and bloating are very common, indigestion, constipation and diarrhea. So depending on the type of IBS you may have, whether it's IBS-C or IBS-D, or it could oscillate. So, I've seen this a lot in my patients over the years, that you're constipated for a little while, then all of a sudden it's diarrhea for a few days, and then it goes back to the constipation. So never really having that, number one, the consistency of that gold standard, poop that I talk about, but secondarily, the fact that it is never, that normal transit time. It's either too fast or too slow. Also, you could have joint and muscle pains from having inflammation in the gut. Also chronic infections, so chronic respiratory infections, chronic vaginal infections, even bladder infections can be related to what's going on in your gut. So that's why repairing that leaky gut, repairing what's going on with that inflammation is really important for all of these conditions. And of course, lack of overall energy. So this is something that you definitely want to, focus on so that you can have bound and loads of energy and, really enjoy your life. So if you're just tuning in, welcome in. I'm Dr. Janine. We're talking about IBD. Please stay tuned. We have our quiz section coming up shortly. I will be getting into my tips to really share with you what you can do naturally and some of the things that you may not have yet heard or you're not yet doing in terms of fixing your own inflammation in your gut. Hello on TikTok as well as YouTube. We are also live streaming on Facebook and Instagram as well. So thank you everybody for being here. Okay, this is the 9 tips for irritable bowel disease. So tip number 1 is to fix your environment. So this, the toxic blue light exposure that we have from our devices, our cell phones, as well as those EMFs. So one of the things you can do right now is put your devices on airplane mode. You should not have your cell phone signal on unless you need to make a call. For people that need to reach you, I'm pretty sure they can text you, and I'm pretty sure if you're in a Wi-Fi spot and you have signal that you do not need to have your, and it drives my family crazy actually, because sometimes they can't reach me by telephone because mommy's phone is always on airplane mode, but they're used to it, and trust me, your family will get used to you not being able to reach you, and sometimes it actually may be a good thing for your inflammation in your gut not to be reached, if you know what I mean. Okay, tip number 2 is to fix your leaky gut syndrome. So I have a whole show on this, and here we can see in terms of what's going on here is that those tight junctions in the gut are something that we definitely want to be able to seal up, and there's different ways to do that, and there's certain nutrients that help to do this, like N-acetylcysteine, selenium, and that's something we will share a link to, a great product below that can help to seal up these tight junctions in the gut. So here, when we take a look at the leaky gut syndrome, so in our small intestine we have this brush border, which we saw in that animation. Now, what happens with leaky gut syndrome and with that overall inflammation in the body is that those tight junctions can open up, and certain things will do this, like that EMF exposure that I was talking about. And this is not what we want, because now when our food goes through, and this is when we're lacking digestive enzymes, so our food isn't properly digested in the first place, it can pass through undigested, and now this is where the immune system can actually react to this. So now what's even a worse case scenario is that here with the leaky gut, and when we talk about SIBO, we talk about those bad bacteria, we talk about parasites, we talk about candida, those bad guys. He's smiling, but he's not so friendly actually. He's happy because he's living off all our foods and things. And we're not happy, but he's happy because he has a great home to live in. And guess what? He's going right into our bloodstream, and this is the leaky gut. So this is definitely something that we want to repair, so making sure that we're fixing that leaky gut syndrome is really important. So do check out my episode, The Science of Leaky Gut, everything you need to know about leaky gut, with the tips there to help you. And some of those tips will actually cross over with the tips that I'm sharing today, because it's important to be able to help you. And really, sometimes you need to hear information about 11 times to actually start to really have an impact on what you're actually going to do and take action over. Okay, tip number 3 is the castor oil pack. So this is something that you can do over your abdomen. So, if you've got that pain and inflammation, I want you to cover your liver area as well, which is on your, right-hand side. So that's something you can definitely do. I have videos and TikToks how to do the castor oil pack, so make sure you check that out as well. And that's something you're going to do at least 3 times a week. It really is fantastic for that inflammation, but it also helps something called the GALT. So that is your gut-associated lymphoid tissue and part of your immunity that's specifically related to what's happening in your gut and for digestion. So the castor oil pack, 45 minutes at least 3 times a week. This is a game changer if you have inflammatory bowel disease. Okay, tip number 4 is Mother Nature's prescription. So I want you to get outside. I want you to exercise outside. I want you to get that natural sun exposure. You've got to get that sun on your skin and in your eyes, especially the sunrise in the morning. So sun gazing, look at that sunrise in the morning, get the sun on your skin. And the other thing I want you to do, which I've not said before, is expose your abdomen, expose your gut. So lift, and I do crazy things. So my neighbors, yeah, I do it in a hidden way. So I will actually stay in my garage. I'll open up the garage door. The sun is beaming in, so I don't think anybody can see me. I hope nobody can see me. But I actually lift up my shirt and get a few minutes of sun exposure on my abdomen, because our gut actually gives off light and our gut needs light. So doing that in the morning is a fantastic way to really help with that overall inflammation. I also do it grounded, so I will stand on, my garage floor without my slippers or without shoes on to make sure that I'm actually grounded, and this is important. So getting outside with your bare feet on the ground is something that you absolutely need to do every day, and this is life-changing. I mean, if you're not already doing this is life-changing in terms of inflammation in your body. It helps to draw the negative electrons from the earth into your body and really help to run all your circuits properly in your body. Also, part of Mother Nature's prescription is drinking high-quality water. So especially those who have IBS-D, I really want you to make sure, and this is for anybody, for any type of inflammatory bowel disease, but especially for the diarrhea sufferers, is to always drink from glass and make sure that your water source is very good. So reverse osmosis water is one of the better ways to go. And make sure there's no fluoride. So if you're drinking regular, tap water from your environment, your municipality, unfortunately, not only could you be picking up parasites because some of them actually bypass the chlorination process in the water, but because of the fluoridation, this is a big problem and turns off our brain circuits and things. So that's a whole other show. As well as getting fresh air. So that's part of Mother Nature's prescription. So get outside, enjoy air, and, breathe in that oxygen that Mother Nature provides for us. It really does go a long way for calming down your mind as well, and that's always related to, what's going on in terms of that in irritable bowel disease. Now, tip number 5 is to avoid some foods, and this hopefully isn't forever, but definitely at the beginning. So if you've got Crohn's, colitis, any type of IBS, the SIBO, there are specific foods that your doctor probably has mentioned. So definitely the inflammatory foods. We talked a little bit about, the inflammatory oils. You want to decrease your exposure to these as much as possible, which is important. So this is the canola oil, the vegetable oils. Just get it out of the diet. I mean, don't even finish what you have in the kitchen right now, just toss it. Trust me, it is really worth it to get rid of these. So if you're cooking with them, you can find alternatives, and some of the things that you can use are ghee. I love coconut oil as well. Avocado oil, if it is coming from a good source, would be another option for you as well, and olive oil is okay as long as you're not cooking it at high temperatures. Also, you want to decrease some of the lectins. So lectins and leptin are different. So leptin, you've probably seen my videos on that. If you've missed my show on leptin resistance, please do check it out. But lectins are found in undercooked beans and legumes, as well as in tomato skins and undercooked potatoes, and wheat. It contains lectins as well. So no wonder it's so inflammatory. So you've got to get these out of the diet, especially at the beginning when you're trying to repair that gut and the leaky gut, as well as sugar. And I'm sorry, I hate to do that because, I know sugar tastes good, but it's not good for that inflammation in the gut. I have a whole show all about, sugar addiction, so make sure you check that out and some of the alternatives that you can use. Now, what some practitioners will actually recommend is the low FODMAP diet. So this is something that will limit the oligosaccharides, the disaccharides, the monosaccharides, so different types of sugars, and the polyols. So these are in some fruits and vegetables, but also in artificial sweeteners. So some of the oligosaccharides would be wheat, rye, which we've talked about already, in terms of the gluten and the lectins. Some fruits and vegetables will also have the oligosaccharides. Some of the disaccharides would be milk, yogurt, and soft cheeses. So again, depending on what your doctor has recommended for you in terms of, the low FODMAP diet, may be something that you have to do at the beginning. But there's a double-edged sword here, because as you're restricting these foods and now not feeding some of those bad bacteria, if there's not the proper sort of kill phase of those bad bacteria, then this can be a problem in terms of these things sort of coming back and being rampant when you start to eat, the FODMAP foods again. So again, just food for thought in my own opinion. Definitely work with your practitioner, but sometimes this can be very helpful at eliminating these foods at the beginning to be able to decrease that overall inflammation in the gut. Okay, tip number 6 is some other dietary changes. So definitely increasing your probiotic foods. Sometimes you may need to go to a supplement, but here we have sauerkraut. So this is something that I actually make myself. It's absolutely delicious. I have a whole video on how I make my own, so make sure you check that out on YouTube, as well as increasing the fiber in the diet. So here's one thing that you may not have heard about. I did do a TikTok on this, the chitin. So the chitin is in our seafood. So yes, I had shrimp yesterday. I try to eat shrimp a lot. I love it. I know it's controversial. People say it's a bottom feeder, and I don't believe any of that, because we need the seafood. It's so jam-packed with, a lot of these very important nutrients that we need for our leptin and to run our batteries in our cells. So the chitin is the shell of the shrimp and other crustaceans, which is a fiber, and this in particular, this fiber is fantastic at ensuring that that process of our digestion is slowed down to the point where we can actually extract all the nutrients that we need, and it helps with that diversity in the gut bugs as well, so in our microbiome. So yeah, try it next time. I used to only feed the shrimp tails to my dog, but now I enjoy them myself. And yet you got to chew them really well because they are quite crunchy and they can sort of get stuck on your teeth and things, but just try it and see what that does for your digestion, as well as increasing your healthy fats in the diet. So you definitely want to make sure that you have enough DHA, and that's why I like seafood, but also that DHA is something that converts our light in our gut to an electrical current. So this is where the light and the sun all comes together, and that electrical current or the DC current and a magnetic message is then translated to the GALT, which is the gut-associated lymphoid tissue. And if we're not getting enough of that sun, and if we're not connected to the earth, and if we're lacking in that DHA, this could be the actual place where that gut inflammation is starting. I know it's crazy, you've probably not heard this before, but really important that we are making sure that we have enough of that DHA. So some people who aren't eating enough seafood and fish may need to go to a good high quality product, so we'll make sure that we share that link below to something that's fantastic in this department. And also what the GALT does, so the gut associated lymphoid tissue is part of the immune system for our gut that actually protects the body from invasion. So remember these guys, that invasion, you want your GALT to be working and you want to be having enough DHA every day to ensure that we are fighting against these bad guys. Now, another thing especially I want to talk a little bit about the IBS-D sufferers. You can also make sure that you are eating some pumpkin seeds. This is really helpful in terms of fiber, but also helping to slow down parasites and some of those, negative organisms, and bitter greens. So any bitter green, vegetable, those parasites really don't like them, and we have to slow down those bowel movements. So, really focusing on these is fantastic. Like bok choy, like, the arugula, some of the darker bitter greens are fantastic for IBS-D, but also for IBS-C and the other types of irritable bowel conditions. Okay, tip number 7 is to include some herbal medicines. So definitely, I always recommend at least a few times a year to get ahead of that toxicity, and a full body detox is definitely something that you can look into. So we'll share some links below. I'm not going to focus too much on it because I want to get to our quiz section because I've been talking a lot today. But yeah, so definitely a full body detox, as well as doing a parasite protocol. So making sure that you are, eliminating and getting rid of, in a safe way, using herbal medicines that are very targeted to get rid of those parasites. So yeah, that's something more that you can learn about, and we will share some links below to other videos on how to do that, and some of my favorite herbal medicines will be listed there as well. Okay, tip number 8 is to do the ileocecal valve massage. So this is something that you can check out. Again, I have another video on this. I have a TikTok on this as well. And basically and this is especially great for IBS-C people that have, the slow bowels, is that you're going to find that ileocecal valve. I show you how to do that in that video. You're going to massage there. There's a whole technique on how to do this, but this is great for the children as well that are constipated. You can help them and you can actually do it for them. And it's amazing how this really does get things moving, because it was a mechanical thing, and that's why your stools were not emptying and that food wasn't emptying properly from the small to the large intestine. So make sure you check out that video, the ileocecal valve massage. Okay, tip number 9. So as you know, in all of my shows, I like to bring in the mind-body connection and the energetic spiritual as well. So in terms of gut health, we know that stress is a huge component, but I really want you to think about stop swallowing what's bothering you. most, if not all, of the GI people that I've ever had to treat in my long career as a naturopathic doctor, there's always been a component of not only the stress, but also not really dealing with what was bothering these people in their environment. So really, you know, just kind of swallowing what those stresses were, swallowing, and think about it, that right on contact, if that's a negative energy or whatever that is, swallowing that down, or a negative emotion, swallowing that down is going to cause the body to have an effect, and that's going to be inflammation. That could either go diarrhea, could go constipation, it could be SIBO, it could be, you know, the growth and a friendly environment for these bad guys to grow. So really, you've got to take that into account. You've got to either talk to someone, have some resolve around healing, you know, what it is, and let it go, let it go, let it go. Whatever it is, whatever is not serving you is not serving you. You've got to let it go. So I hope, you know, that you're going to take this to heart, and anybody who's suffering, I don't want you to suffer. And by doing the tips today, I really want to hear from you how it's working for you. Please do leave it in the comments below. I want to say hello to Mackenzie. Has a question on YouTube. If your transit time is less than an hour, well, definitely there's something happening there in terms of, you know, eating something that you can actually see marked in your stool. And if that's happening very quickly, it's going right through you. So you're not going to get that nutrient density. Your cells will not be able to absorb what you are eating in your diet. So definitely something to get checked out, but hopefully the tips today will help you in this regard to help to slow things down. And, you know, increasing fiber would be one of the things to consider in terms of anybody who's watching who has a really fast transit time. Usually fiber would be the first thing that I would think of. Okay, it's quiz time. Is everybody ready? Okay, maybe I'll pass the poop plate back to my friend here. Thank you very much. And now I'm gonna stream, so hopefully I can see all of your questions nicely. I hope we're ready. Elizabeth, thank you. Some nice comments here. Wow, everybody's in such a good mood on this Monday afternoon, morning, evening, wherever you are. So hello to everyone. I know that you're all streaming in from different places in the world, so I always appreciate that. I see Ireland is here, someone from Canada, that's awesome. Somebody in the US as well, and Kentucky, so thank you, thank you. Okay, here we go. Are we ready? Quiz question time. True or false? Number one, true or false? Coenzyme Q10 helps with skin hydration and wrinkle depth. True or false? Anybody have it? TikTok's fast. Woo, Leslie's fast. Kathy, fast. Goldberg, fast. Wow. User 989436. Yeah, TikTok is very fast. Shana Babana. Instagram's got it as well. Wow. Aisha's here. Hi, Aisha. Aisha's like, I think she's 100 for 100 on all the quiz questions from like show to show. Kimberly, good. Elizabeth, nice job, ladies and gentlemen. Anybody else? Oh, YouTube's got it too. Catherine, good job. Okay, fantastic. Okay, so the answer is true. Yes, coenzyme Q10. So ladies, gentlemen, it's a game changer for your health. And I'm not talking about using it topically, because I know a lot of the beauty companies use it topically in their products. I mean, taking it internally as a supplement, and it has so many other advantages and tips. It's something that we talked about last week. So make sure you check out last week's show on YouTube if you missed it. So make sure you check that out after we're done today. Okay, question number two. And I should have said, this is what we're drawing for. So this is the vegan protein powder. This is a huge, great, awesome thing that you can possibly win, and you know the benefits of this are awesome. So you can check this out on the VitaTree website, but really great and formulated to actually help with leaky gut and some of the things that we talked about today. So make sure, yeah, so good luck. Okay, I should have said that before we started. Okay, question number two. Name a type of wine with the highest resveratrol content. Name a type of wine with the highest resveratrol content. Are our TikTok people seeing this or no? Maybe not. I don't know if that's, okay, sorry. Okay. Oh, we have to be a bit more specific than the color. Oh, CCS Skippy, nice. Danetta, nice. Oh, Kimberly Johnson, wow. Aisha, nice. Aisha, wow. You guys are great. Now, I will not accept the answer red. I need to know the type. The type. And I should be more clear, maybe one of the ones that I mentioned last week. Don't forget, even if you just attempt the answer, you're good. You're still entered to win the prize. Anybody else? Janice? Possibly Janice on YouTube, possibly. But it's not one of the ones that I mentioned last week. Anybody else? Okay. Well, let's show the answers. So the top ones are Malbec, Petite Sirah, Saint Laurent, and Pinot Noir. So if you named one of those, you were absolutely correct based on what I shared last week. Good job. Malbec is probably one of my favorites. Okay. Are we ready? Question number 3, true or false? Resveratrol can be found in blueberries. Resveratrol can be found in blueberries. True or false? Because people always talk about the wine, but is it true or false? Marie. Good job, Marie. Marie, you're fast today on YouTube. Wow. This is awesome. And Marie, I'm glad that you were able to find us. TikTok has it? Yes. DC Glamour. Eat your veggies. I love that handle. That's awesome. Jay Karsha, Amanda Hutton, Chris Hammond, SunMap 2020, awesome, awesome. Heels to hiking, no. Okay, so the answer is, anybody else have it here? Janice, good. Marie, good. Catherine, Instagram has it as well. Praising Lady has it? Awesome. M. Baines 13. Okay, good job on Instagram. Yes, it is true. So resveratrol can be found in blueberries, so eat your blueberries, ladies and gentlemen. It's very healthy. Okay, question number, can you tell? It's been a bit. I talked a lot today. Okay, question number 4. Name the phenolic acid in green coffee beans that helps with weight loss and blood pressure. Ooh, now we'll see who's been paying attention. Name the phenolic acid in green coffee beans that helps with weight loss and blood pressure. I don't know if, can we show, can we see it? Oh, they can't. Okay, never mind. That's hard for you guys. Oh, okay. That's all right. I thought I could let TikTok see this a little bit more closely, but I'm wrong. Eat your veggies. You're having fun? Okay, I'm glad. On a Monday, we need to have fun. Awesome, awesome. Okay, so nobody knows this? So here's the trick. Everybody who's watching right now, watch last week's show. So if you studied last week's shows, this is usually when we, what's that? Aisha? Yeah, look. My team is saying Aisha doesn't have the answer to this. Aisha. I don't know if Aisha was here last week. Maybe TikTok has it? Yeah. Wow, heels to hiking 450. Woo. Kimberly. Aisha does have it pretty close in the spelling, but it was a good attempt, Aisha. And Kimberly. Wow, you guys are good. Ladies. The ladies are Tamara. Nice. Awesome. Okay, should we show it? Anybody else have an attempt? Edroff, chlor something. Yes, Leslie Murphy. I like the attempt. You get a tick off for the attempt. Good for you. Instagram has it as well. Good job. Yep. Okay. So the answer is chlorogenic acid. So that's something I talked about last week. Really, an important phenolic acid that really helps with more than just weight loss and blood pressure. It is anti-aging, helps with leptin levels as well. So yeah, it's really good. Okay. Question number 5. True or false? Ashwagandha is an adaptogenic herb. You got to be quick on this one. This one's too easy. Who's going to be first that I can see? CCS Skippy, very fast. Melbird. Melbird's here. Nice to see you. Thank you for tuning in. I didn't see your name earlier. True or false? Yes, yes, yes. TikTok is very quick. Janice is very quick on YouTube as well. YouTube's really fast today. Marie. Marie, I hope so, yeah. Yes, adaptogenic herb, helping with stress. Kimberly is here. Aisha here. Good job on Facebook. Elizabeth, good job. And this is fantastic. Okay, great job, everyone. So the answer is, Instagram has it as well. The answer is true. Yes, ashwagandha is an adaptogenic herb. So this is really herb or herb. I know, depending on where you're streaming in from. People make fun of, well, not make fun of, but they comment on apparently I have a very Canadian accent. So it's funny the comments I do get on social media, but it's all part and parcel of being and sharing information and being on social. So thank you so much to everybody who tuned in today. That was a super fun show. I hope that you learned something new. Please be sure to share this information with your friends. I know if you're streaming in on TikTok, you can refer back to it, or on Instagram, you can refer back to it. On YouTube, make sure you check it out in case you missed something, you want to take notes. A little hint for next week's quiz questions. Check it out on YouTube. Make sure you're subscribed to my YouTube channel as well. It's Dr. Janine Bowring on YouTube. And that you're, subscribed to my other platforms. I share different bits of information on different platforms just to keep it fresh and to keep you guys always informed and knowing new things. So on Instagram, I'm at Dr. Janine, the same handle as on TikTok. And it was so fantastic to have all of you here today. I really do appreciate it. Remember, stay on the line if you're watching on TikTok and Instagram. I'm going to stay and answer some of your questions. I appreciate all the love that you give me. So all the presents, the diamonds on TikTok, the thumbs up wherever you're streaming in on. And yeah, make sure that you're subscribed so you always get my newest and latest uploads. And remember to always take good care of your health and do it naturally. Thanks for watching today.